Hi, this is Sarah Kane, and I am doing my CPE and interview reflection for my field experience. And I chose for this project to update what is currently the St. Joseph's Healthcare System pain assessment for they use the pain assessment for the whole entire hospital. So the idea for this project was to update that assessment to apply better to labor and delivery women who are expecting to be in pain, and to create a better way to document for the nurses and for the patients adequate pain intervention, acknowledging that they're going to be in pain and that we're not trying to get to a pain score of 0. So I came up with this idea because I actually am a labor and delivery nurse, and so I was working there and realized that the pain score is just a numerical unit that just asks if they are in pain and doesn't ask anything sort of about how they're coping with that pain or if they're coping with that pain, and doesn't offer any intervention beyond the standard sort of hospital-wide pharmacological and non-pharmacological intervention. So it's actually interesting to come up with this because it's near and dear to my heart, and because it's something that I was very interested in. And so creating the idea and coming up with this sort of pain coping assessment in place of a pain scale was one of the ideas that I think will actually change in my practice. And so that was something that I really liked about it. I think then, because I was so gung-ho about it, it didn't occur to me that maybe other people would not be so gung-ho about it. So that was what my sort of favorite part of the stakeholder interview was, because they had some really real sort of grounding ideas about maybe everyone won't want to do this, maybe IT doesn't think it's worth it to make a second pain assessment, maybe we're just adding in more documentation and we're not really going to make a difference. And so then to take that and roll with it and still try to come up with a good project was very interesting for me, so I was very excited to do that for this.